Welcome to Your Family's Health. This is Dr. Janine Cook-Garrard, and I'm here along with Professor Marilyn Hendricks. She's an adjunct professor here at Nassau Community College, and we're here to talk to Joe Reynolds. Your Family's Health is a program that focuses on healthcare issues and resources available here in Nassau County. On the show, we will be speaking to experts from around the country to keep you up to date on current healthcare issues and trends. Today, as I forestated, we will be speaking to Joe Reynolds, and he will be speaking to us about self-injection. So if you want to know more about how to stay healthy in Nassau County, stay tuned for the next half hour to the voice of Nassau Community College, 90.3 WHPC. And welcome to the show, Joe.
Hi, thank you. Thank you for having me. It's a pleasure to be here.
Likewise, it's a pleasure to have you. I'm just going to start off this session with telling us a little bit about who you are.
Sure. So I am the research manager here at Noble, and as an organization, we're a product development and manufacturing company that focuses solely on device training and patient onboarding to drug delivery devices, ranging from prefilled syringes, auto-injectors, and respiratory inhalers, all the way to novel on-body systems. And as part of the research team, I work closely with our customers as well as our internal development initiatives in order to develop products that address unmet patient needs in the market.
So you are the manager of this enterprise. Is that true?
I am part of our research team, yes. Mm-hmm. We have quite a few departments at the company that work in different areas, and I have the pleasure of working on the research side of the business.
So this device that is a self-injector, tell us about this particular device.
Well, self-injection devices, they've been around for around 20 or 30 years now. We started to see early launches in the diabetes market with some of the early insulin products and injection pens that supported patients taking those medications. But over time, we've seen an evolution towards more self-injection devices, devices like prefilled syringes, auto-injectors, as well as safety syringes that patients use to treat a wide variety of chronic and acute conditions.
So, Joe, this is Marilyn. I just have a question for you. If you could just please clarify this for the audience. What are some of the diseases and types of treatments that you think that may require a patient to self-inject? Sure.
Well, thank you, Marilyn. There's typically three categories of conditions that require self-injection. There are chronic conditions, things like diabetes, rheumatoid arthritis, MS, psoriasis, lupus, and a wide variety of other conditions that require patients to treat them long-term with injection therapies. But there's also a class of acute or short-term treatments for conditions like migraines, nausea, or inflammation. And then the third area is for what we consider rescue treatments, and those are typically used in an emergency situation, things like epinephrine or glucagon for diabetic patients. Mm-hmm. So those are kind of the three key areas that we see for self-injection.
So, Joe, with the group of patients that you do get a chance to talk to or maybe survey, are more patients being prescribed, as far as you know, more injections than in the past today, more today than in the past?
Well, we're certainly seeing a lot of growth in the industry, and a lot of that is based off of a lot of the innovative science and technology in our current portfolio. As you know, a lot of our biotherapeutics today have really changed the way we practice modern medicine, and they've extended a lot of treatment algorithms and taken our industry into new therapeutic areas as well. So we've seen a lot of growth based off of that. And a lot of the forward-looking growth in the industry is really based off of the pipeline of future medicines that are currently in development and going through clinical trials. I saw a statistic from pharma recently that referenced over 7,000 medicines in clinical development, 73% of which could provide first-in-class therapeutic benefits to our patients. So it's some of those and other factors that we do anticipate to see a lot of continued growth in self-injection moving forward.
So describe for the listening audience, what does this device look like? Is it look like a pen, or is it, describe, is it look like a syringe?
Right, so a lot of auto-injectors and injection pens today, they are close in appearance to a pen, a writing pen. There are some syringes as well that look like what you would imagine to be a syringe, and a lot of them incorporate a lot of really novel features to make sure that patients can safely and effectively inject their medications.
So, Joe, when a patient find out that they're getting or their treatment requires self-injections, walk us through, if you know, some of the typical reactions that you think patients usually say to you or you know of.
Sure. Well, it's definitely a very emotional time period for many patients, and depending on the condition, those feelings can range from shock and sadness to fear, guilt, all the way to anger. And commonly, these emotions, when they're not properly supported, they can unfortunately manifest into stress and injection anxiety as well.
So I know that as clinicians, both Marilyn and I, we do notice as we are about to inject patients with any given medication that there is an anxiety that goes along with that. Mm-hmm. How does this device allay those fears or anxieties, or do you find that it does at all?
Well, injection anxiety, I definitely agree with a lot of the anxiety that patients have, whether it be a vaccine or self-injection. And we commonly view anxiety as the phobia or the anxiety that prevents patients from self-injecting their medication. And unfortunately, we found it to be a significant adherence and outcomes barrier for patients that are self-injecting their therapies themselves. Now, we have found that with the right training and support that we can effectively mitigate that anxiety and build confidence in our patients to make sure that they are properly onboarded to their treatments and to make sure that they have the tools and resources that they need to manage that themselves long term.
So, Joe, I know you get a chance to work with nurses and other healthcare providers. So what can nurses or other healthcare providers contribute or help these patients that you suggest that we can do to help these patients overcome this type of anxiety that you're talking about?
Mm-hmm. Well, we certainly love our healthcare providers in the industry, and I would just continue to encourage them to leverage tools and resources like training devices to help onboard patients to device-delivered therapies. And all of those resources are typically accessible through pharmaceutical manufacturers. There's a lot of support and resources out there for both healthcare providers and patients. And we find that, the concept of onboarding, and when we think about onboarding patients to self-injection, we find that the first 30, 60, or 90 days of treatment are typically a very, very important time period for most patients. It's during that process where their initial attitudes and behaviors are established, and we want to make sure that through that time period that those experiences are as beneficial as possible and that they get to realize the full therapeutic benefits of their treatments.
So this requires healthcare providers and nurses possibly to do some training. So this is not just instructional training, but the patient would have to show that they are comfortable and proficient at giving themselves an injection?
Well, that's definitely a very important factor. A lot of the treatments that are self-injected, the patient will go into their healthcare provider office, and the healthcare provider will introduce them to the device, hopefully instruct them on the right ways to use it, and then the patient will return home, and they'll be responsible for injecting their medication either every day or weekly, bi-weekly, sometimes up to every month or every other month, depending on the treatment regimen that they are prescribed. So it's definitely very important that the patient can confidently self-inject at home with their device.
What is the cost of this device? Is it covered under their insurance, or how does that work with cost?
Sure. Well, the training devices that we develop are typically distributed through pharmaceutical manufacturers at no cost to patients or healthcare providers. So they are onboarding and educational resources that the industry likes to provide to users to promote adherent behaviors and meaningful patient outcomes.
So, Joe, when a patient is going through the onboarding process, I just want to, for our listening audience, because a lot of people are lay people out there, and they're hearing about this self-injection device. And what are some of the things that we talk to patients about in terms of how to self-inject? What type of practice tools that we give to them while they're in the onboarding process? And lastly, Joe, and this is kind of a loaded question, is there a follow-up at home in terms of a trainer accompanying the patient?
Mm-hmm. Right. So as far as the key steps go, it's very important for patients to understand how to handle their device. Mm-hmm. So the key things that they need to do in order to prime it or prepare it for injection, there are things that they need to know in how to actuate it, how to start the delivery process. And then typically with self-injection and auto-injectors, there is a wait time period where patients need to hold the device in place to wait for the full volume of medication to be administered. And that's one of the key mistakes that we see occurring most frequently in the industry, is that patients start the injection process, but they don't wait for the full medication to be delivered. So that is something that's very important to keep in mind for patients, to wait for all the medication to be delivered. Now, as far as common tools that are used, we see training devices as a real cornerstone to effective patient onboarding, both in the healthcare provider office, but also for patients to take home and practice in their home setting. We have some patients out there that take a training device home, and they'll use it for their first few weeks of therapy until they build the right muscle memory and they feel confident in their ability to self-inject. And then we also have some patients that like to practice multiple times with a training device before they do a real self-injection for the continuation of their therapy. So it really depends on a particular patient and their needs, but we see a lot of value and we hear a lot of positive feedback from patients that use training devices at home.
Okay, Joe, this is a good time for a break. You're listening to Your Family's Health on the Voice of Nassau Community College at 90.3 WHPC. This is Dr. Janine Cook-Garrard, and I'm here with Professor Marilyn Hendricks. And we will continue talking to Joe Reynolds about self-injection right after this short break.
Technology moves at the speed of innovation, and today,